This video is a demonstration of clinical palpation for the back. Different from the peripheral joints, the clinical reasoning is a little bit different. For the back, we try to find out all the common impairments instead of having preset hypothesis, because for the back, a lot of back conditions are non-specific, or even specific back pain, they come with a lot of associated impairments. So different from the peripheral joints, we try to find out as many impairments as possible rather than a fixed clinical pattern. For back palpation, in the undergrad, we learn the basic is to feel the temperature and then all the passive accessory intervertebral joint movement. Okay, to add on, for muscle, I usually will find the muscle overuse or muscle tear. For some specific muscle tear, then of course you'll find in the back extensor, because when the weight lifter, they usually shrink this muscle. What is the feeling of the muscle or supraspinal ligament tear is that they complain of a little bit tightness but not painful. It happened just a few days ago. When you press on it, you will feel supraspinal ligament. You will feel that a particular segment is different feeling from others but not very painful. Same as erector spinae. We don't expect a lot of pain, but you feel that on the spot is that a different feeling, a little bit sinking in and the tension around the spot. And then different feeling around that spot. Okay, this is how to find out the minor muscle strain or ligament sprain tear. But for overuse, a lot of people say the back is very stiff. The overuse is not on the extensor erector spinae muscle. It's rather on the quadratus lumborum muscle. To palpate the quadratus lumborum, instead of behind, we go from a side, from lateral to medial. From lateral to medial. That's how to find the trigger point of the quadratus lumborum. Okay. Then after quadratus lumborum, regarding the soft tissue, the piriformis sometimes is associated with some piriformis tightness. There is a trigger point for piriformis from the cradle trochanter to the ischial tuberosity. Draw a line. In this line, get about one third, then easily find the trigger point there. Some people may wondering whether it's gluteal medialis or piriformis, but we cannot 100% confirm, but can tell you that a lot of muscle, back muscle overuse, they have the tenderness on this muscle. And then don't forget to palpate all along the hamstring, because according to the biokinetics, the hamstring is the kinetic sling of the lower back. Okay, so that's why if they have back instability overuse, they also have tenderness on the outer lateral side of the hamstring. Okay, instead of the middle one, we feel more the lateral one. Okay. Going from a little bit inside, okay, for sacroiliac joint dysfunction, no matter up flare, out flare, down flare, usually they come with the tenderness of the sacroiliac joint ligament. The ligament you can visualize like a triangular shape here around the sacrum. Then we find the outer side of the ligament that has some normal sensitivity. But compared with the other side, if you see the sensitivity are the same or different. Okay, for sacroiliac joint dysfunction, the sensitivity of the other side definitely will increase. Then for the passive accessory movement, we do as the usual way, either use a pisiform handhold or use the thumb handhold. But for the particularly pulling down a little bit the L5 S1 level, usually is more sink in. And then on top of the sacrum, you put a thumb like this, okay, to feel it, because it's very small and precise. If you sometimes the lordosis is quite significant, you may add a pillow underneath the tummy to flatten the lordosis to find it. Okay. Then also from a side, beside the passive intervertebral movement, the unilateral PA, remember also to feel sometimes the thickening on the ligament of the facet joint. Sometimes maybe acute joint sprain, and then feel the ligament tenderness as well. Okay, so those are the clinical palpation of the lower back.